Good afternoon, Dr. Berger.
Hello, Irina.
We're getting a lot of questions about GLP-1 side effects. Can you elaborate a little bit about weight management medication?
So, in particular, the GLP-1 and GIP receptor agonist medications, which are Ozempic and Wegovy in the first class, and Mounjaro and Zepbound, which are both GLP-1 and GIP agonists, they work in similar ways. So the receptors for these hormones are located in the gut, but as well as the hypothalamus of the brain. So what's supposed to happen is after you eat or if you gain weight, your natural GLP-1 and GIP hormones should increase in concentration. They should interact with the receptors in the gut and slow down how quickly your stomach empties. We call that gastric emptying, and should interact at the level of the hypothalamus to help control appetite at the level of the brain. However, that doesn't often happen as people gain weight to a certain extent, develop prediabetes, diabetes, and so forth. So we have these medicines like Wegovy and Zepbound to help with weight, and because they slow down how quickly your stomach empties, the digestive process, you can get some GI side effects. So principally those are nausea, acid reflux, and constipation, because we've basically slowed down the whole process in the gastrointestinal tract. So we can get around these in a couple of ways. We can have the patient drink more water, increase fiber in the diet, take fiber gummies. There's also a product made by a company that we use for our meal replacement products. The company's name is Robard, and they make a drink. It's a protein shake called BioCare that helps our patients a lot with these side effects. And occasionally we may need to use a little bit of medicine to help with these kinds of things, medication for acid reflux or medication for nausea. In more so with Ozempic and Wegovy than with Mounjaro and Zepbound, there can be constipation for the same reasons, because we've slowed everything down. So the things I mentioned before, the hydration, the fiber, and so forth, are good to help with that as well. And also just bear in mind that these medications have multiple different dosing levels. So we basically start low and go slow. And if a patient starts to have side effects on a particular dose, we may back off and go down to the prior dose, which may help with the issue as well. Not very commonly, but not ultra rare either, is pancreatitis. So bear in mind that originally these medicines were developed as diabetes treatments, and they work in that regard by increasing the amount of insulin that the pancreas creates. So because they work in the pancreas, occasionally the pancreas can get a little angry, inflamed. We call that pancreatitis. If that happens, a patient would need to go to the emergency department and get some IV fluids until it calms down, and then we would need to think about using a different medicine. It's not super common, but it does happen. So those are the primary side effects. The things we see commonly are nausea, constipation, acid reflux. Pancreatitis is not very common. One thing I should mention just quickly, though, is that any form of rapid weight loss can also decrease a person's muscle mass. So that's something that we watch very carefully in the clinic here by using a body composition analyzer. We use a Sika bioimpedance device. Because whenever you're losing weight, it may not all be adipose tissue fat. It may also be muscle mass. So people say that's a side effect of GLP-1 and GIP medicines. I look at it more as a potential side effect of anything that causes rapid weight loss, including big changes in your lifestyle. So whenever you lose weight, you could lose muscle as well as fat. So we always need to be watching protein intake and strength training and tracking this with body composition analysis.
What are your thoughts about compound?
Well, compounded medications I was never in favor of, frankly, because they were not made in pharmacies that are strictly FDA regulated, like the pharmacies that make IV fluids or antibiotics for hospitals when there's a shortage. But now that we're getting out of the shortage with Wegovy and Zepbound, compounded medications are no longer going to be permitted to be sold to patients. But I've never been one to prescribe them. The Obesity Medicine Association also has a clinical practice statement that is not in favor of using them. But it appears that they're going to be disappearing from the landscape because we no longer have shortages of the FDA approved medicines, that was the only reason that it was permitted to sell compounded medication for weight loss, was because of the shortage of the FDA approved medicines.
And how affordable are those FDA approved medication? If and how often the insurance covers those medications?
So they are expensive medications, can be anywhere from $1,100 to $1,300, depending on what we're talking about, full retail price. The manufacturers do have coupons. It's about 50% off, depending on the company and which medication you're talking about, and the day. It changes all the time. But you can get approximately a 50% off coupon from the manufacturer of the medicine. In terms of coverage, it's variable. A lot of insurances will cover these medicines. They've come to understand that preventing all the chronic diseases that can go with obesity is actually going to cost the insurance company less in the long term than to cover the medicines. But there are plenty of insurance companies that just look at the cost of them and don't cover them for our patients. If that's the case, there are oral medications that we can consider that are much less expensive and can be very effective for a lot of our patients who don't have insurance coverage for injectable medications.
Very often, our patients very much in anticipation of how much I will lose and how quickly. Can you talk a little bit about in terms of percentages, and sometimes also it takes some time to determine what works for each patient, right?
Yes, so I always discuss the average weight loss with each medication, but have the patient bear in mind that there's a bell curve, that there are people who fall above that average number, and there are people who fall below it, and even some people who don't respond to a particular medication at all. So in the studies of Zepbound, for example, it was 21% weight loss on average. So there were some who had more and there were some who had less. Wegovy, which is the same ingredient as Ozempic, semaglutide, some were more on the order of 14-15% weight loss. But I always tell my patients that everybody reacts differently. It's not like in the studies everybody lost 21% on Zepbound. There's variability around that mean, around that average. So basically we see how it goes. Some people lose a great deal on just the starter dose. Some people need to go to the highest dose. It's quite variable.
And you also mentioned that rapid loss, it's not such a good idea. What would be the proper pounds per week?
So I look at it more per month, and it varies really with how much the patient has to lose, but I like to keep it somewhere in the neighborhood of 10 pounds or less per month. If you're too aggressive, you're at risk to lose muscle mass, as I mentioned. But if it's too rapid, you also have risk of gallstone attacks, of cholecystitis. So although patients would love to lose weight more rapidly than that, I try not to be too aggressive for those two reasons.
All right. Thank you, Dr. Berger.
My pleasure. So we're Northeast Medical Practice. We are a concierge-style internal medicine, weight management, and aesthetics practice located in Great Neck, New York on Long Island. If you'd like to reach out to us for more information, the number is 516-604-3418, or you can find us online at northeastmedicalpractice.com. And as always, everything that I've discussed in the video is for educational purposes only. We have not established a doctor-patient relationship. And if you have questions or concerns about your health, you shouldn't hesitate to reach out to your healthcare professional. But in the meantime, hope to see you soon and be in good health.